Horse Racing Show. I'm Kenny Rice. Thanks again for tuning in. It's time now for our Rood and Riddle Vet Check, and I'm happy to have with us one of the best in the business. Many times I've interviewed him on live TV, and it's always about a horse injury, how this horse is doing, and every time he comes through with a simple explanation for people like me to understand and the viewers to understand. Al Ruggles joins us.
Well, thanks, Kenny, and thanks for the compliment, and happy to be here.
Isn't it nice to be talking where there's nothing life and death at stake at the moment right now? I'm not asking you if this horse is going to make it or what's the update.
Yeah, there's no trying to get in communications and try to filter it in a quick manner. So this is, it's a lot more relaxed.
I don't know if people realize actually the time frame you work on. From the time I'm getting ready to ask you, you're on a walkie-talkie talking to the vet who's on the track. He's relaying information. This is all going out within like 2 minutes max. Yeah, maybe of when the horse had to see how the horse is doing. Yeah,
it's really quick, and it's really important to get accurate information. There's a lot of repeating, confirming, trying to we really want to be accurate to the television audience. We don't want to give anything that's not correct. We want to be frank but empathetic. It's a challenge, and the truth is, I rarely see the finish of races because I'm looking down the track. Yeah. And I've been at a lot of finish lines, but I'm mostly watching the back because that's where, unfortunately, some of the injuries happen.
What has been, well, maybe not in, what are some of the biggest changes as far as being able to keep horses alive now with fractures, injuries that possibly 20 years ago it was just impossible to keep them going?
Yeah, there's been a big evolution in repair of orthopedic injury in the horse and management of the entire horse, and I think that's really important. And I would say really even starting probably in the 70s, every veterinary school had sort of a central surgeon. At the time they were all male, so I'll say patriarch of surgery, that sort of delved into what we call internal fixation, where you put in screws and plates. And it really started in the state of the art with people as well. And so the horse industry and the veterinary medicine in general followed that. And then along with that was really improvements in anesthetic management. And that without proper anesthetic management, really, we had problems in recovery. Horses were anesthetized when they shouldn't have been. We're much more relaxed about taking a horse to surgery now. We have ways to stabilize them, splint them. Some severe orthopedic injuries, we typically will wait till the next day when our entire staff is there so we can do our best job. Or we may even wait a few extra days to make sure the soft tissue is in good conditions. And so that's the knee-jerk reaction has stopped. Everyone takes a breath. That's very, very important. We certainly understand how to manage the horse medically, the entire horse, prevent laminitis or overweight bearing on their limb, and then certainly the surgical techniques, using different type of implants, plates and screws to stabilize. Because in horses, the whole thing is making them comfortable. And you make them comfortable by making their legs stable. Yeah. You and I can have an injury and they'll say non-weight bearing for 6 to 8 weeks. You're on crutches. Yeah. You may see someone with a severe injury that has what looks like an erector set on their leg. Alex Smith right now had that open tibial fracture, and he has what's called an external fixator on. Well, those are very weak types of repairs, and they work great when you can tell your patient not to weight bear.
Right.
But we have a little trouble. We can tell them the listening
horses they won't listen to you.
They don't listen as well. So we have to be a little more aggressive. And so the orthopedic surgeons, the physicians that see what we do, they think we're really aggressive with our implants. But we have to be for stability.
Battle of Midway is sad story. A lot of problems going on with Santa Anita right now. They're looking into it. I don't want to offer any conjecture here about anything at this time till we know they're looking at the surface. They're having some problems with it. They're holding off some training in the morning. We do know that. That's all been reported. But Battle of Midway, really looked like it was going to have a great handicap season coming back. It was looking good. And sadly, on the 23rd, he had to be euthanized, shattered a pastern, I think, at his hind.
Yeah, so he had I haven't seen the radiographs, and again, I don't want to speculate, but very, very serious injury. There's lots of different pastern fractures, and the simple ones, we place 2-piece fractures, a few screws. Maybe they're in a cast for recovery, but usually not for very long. And generally, those horses go back to training in 4 months. Yeah. But then you can take that fracture and you multiply it into 20 pieces, and then you're dealing with additional soft tissue injury, open fractures, meaning the skin's been perforated. Things of that nature make it much harder. So there's a wide range, and certainly the connections with that horse decided that with consult of the veterinarian that there was very little hope for him. And with this cluster of injuries in Santa Anita, there, you know, the conditions that the racetracks or the ends that the racetracks do to really ensure horse safety and being firsthand involved in this, I think the general public doesn't understand how primary that is.
Yeah.
And, you know, when we get involved with the Breeders' Cup races, I mean, there's so much discussion about horse safety, and there's so much in and out of competition testing of these horses that, you know, they really, the whole group from the grooms to the track superintendent are trying to help prevent injuries, and that's what they're doing now. They're evaluating the track. It may not have anything to do with the track. It could be a cluster of injuries, and you have to look at data over a long period of time. But when you're having a problem right then, they're doing the right thing and addressing it.
I want to throw some out to you and let you give the layman's terms for it, because people hear about this kind of injury. Where is that related to my body? Is that like my ankle, my knee? Did I pull a hamstring? A sesamoid?
Right. So the sesamoid is a small bone in the back of what would be our knuckle, and in horses is a very important structure. It kind of acts as a fulcrum for an attachment for ligaments. And when horses are in full gallop and they hyperextend their fetlock, if those bones lose their integrity, then we have a problem with complete loss of stability of the limb. And so that's what we call a breakdown injury in parlance. So it would be like breaking your knuckle, which might not be that big a deal, but you're not walking on it and you're not propelling yourself at 33 miles an hour.
Right.
So when that happens, they can get significant injury to the vessels that go to their hoof. And when that happens, that's some of the big problems we have, because now we're dealing with a situation where maybe you and they may have to amputate our finger. We were in a motorcycle accident, we lost our blood supply to our finger, or we had a farm machinery injury. Right. But we can't do that in horses very successfully. So we have to evaluate the soft tissues and the blood supply before we make decisions.
We talked about the pastern. What is that like on a human body roughly? Where would that be?
Right. So right below the knuckle is P1, which is your first phalanx, and that would be the long pastern bone, and then P2 is the short pastern bone, and then the coffin bone is P3, which would be the tip of our finger. So for us, when you break your P1, sometimes they just leave them. Put you in a buddy splint. They might tape the fingers together, right? Or put a small pin, a very weak pin, just to hold things aligned to fix it. But when we have that problem, we have the whole weight of the horse going through it. So we have to actually repair the bone so that the bone and the screws can hold everything together and withstand the load. So it's a high bar, honestly, and I'm not, it's no conceit intended, but for all orthopedic surgeries in horses, it's a high bar because the weight and our expectations to return to athletic competition. A second of lost speed in a mile is 5 lengths, right? So, it's a different, if my golden retriever can jump on my bed, I'm happy, right? But if my horse is a second slower, I'm not happy. So it's a big difference.
Having golden retrievers, I relate, and betting on horses that were slower than I thought they were, I can relate.
Exactly, right, exactly.
So it happens out there, and everybody knows the story of Barbaro and how they tried to save him, and it was a valiant effort and emotional, and cards and letters and everything else from all over the world coming in. And, it's sometimes, like you say, the whole weight-bearing thing, eventually it's very difficult they're not going to stay off their feet, and it's very difficult to keep going as long as you can.
Yeah, there's very big challenges in that particular. My former boss, Dean Richardson, operated on him, and Dean and I are very close friends, and I mean, there's only a few people that would try that, and believe me.
I remember talking to Dr. Richardson after that.
A plus treatment of that horse, and his relationship with the Jacksons was very high to begin with. I mean, you have to have that sort of understanding with the client when you start going down these roads where you have difficult injuries, because it's like I tell people, you're climbing a 100-rung ladder and you get to the 90th rung and sometimes the ladder breaks. Yeah. And if you can't emotionally have a problem, and that some people are like, listen, I can't deal with the complication. Well, then maybe you shouldn't go down that path. You have to have that understanding.
People have that trouble when they have to euthanize their pet of 13 or 14.
It's hard.
I think everybody relates to that. That's why people like horses. maybe not even like horse racing, but they like horses. You know, like horses and dogs. It's hard to knock a horse and a dog, you know?
Well, yeah, something wrong with you.
I mean, yeah, I think you do too.
Yeah, exactly.
Cats we're on the fence about, although I'll accept it.
I will tell you how many cats I have.
Okay, I'll accept.
Being looked at,
I'll accept cats. I fed a feral cat one time. Big mistake. Suddenly, like 10 of them show up in my backyard.
Yeah, you became the
got a little
enabler.
cat gang. Yes,
yeah, exactly.
I was the enabler. Doctor, I can't thank you enough. It's always a pleasure. Please come back.
Kenny. Thank you very much.
Thank you very much. One of the best. Dr. Al Ruggles, that is our Rood and Riddle Vet Check. You're watching or listening to the Horse Racing Show. Follow us and like us on YouTube channel. On Facebook, you can watch us or listen to us actually on iTunes and Google Play. And just like us, because we need we need love, we need to feel it. We'll be back with more right after this.